Hello, guys.
Hello, Dr. Singh.
Good morning. Good
Good
morning.
morning.
Good morning.
Good morning.
Good morning, everybody. Is everybody in? Okay, that's fine. Whoever comes in, they will text message. Hi, Rita.
Hello, Dr. Singh. How are you?
Good, very good. Yeah. Okay, so okay, so good morning, guys. And so this will be a jam-packed session, and I have an agenda items to discuss with you guys. So first of all, I'm going to ask you questions. What are the pain points for the program director? Well, maybe. Second, I can. Can you hear me, guys?
Yes.
Yes, okay, perfect. So let's start from the beginning. So obviously, our main point is to impress upon the program director. But before you impress, you guys tell me what are the pain points for the program director? Go ahead and tell me what are the pain points. Anybody can pitch in.
Good morning, Dr. Singh.
Good morning.
They expect the resident to be easy to work with, be a good team player.
Mhm. Easy to work, team player. What else?
A resident who have a growth mindset, who wants to learn more and adapt to the situation quickly.
Growth mindset, adapt. Okay. What
Have
else?
have some leadership qualities.
Leadership qualities. Okay.
Easy to
Mhm.
teach.
Easy to teach.
A
Outgoing
resident who
to
already knows the system.
Knows the system. Okay. Okay.
who with whom with they are confident that they are going to pass the AIM board exams.
ABIM board
Yeah.
exams. Okay. And what else? So perfect. So I'm going to give you an example. Now, look, this example will help you to clarify everything. So mm, I always tell a story. Okay. Story is what sells. Everybody has heard about Three Idiots movie. Maybe Kant has not, but in Three Idiots, people think hero hero is Amir Khan, correct?
Yeah.
Right. So Amir Khan is not hero. Hero is that person which you person who is at zero and then taken to hero level. The two of his other friends who love different passion than being an engineer, they were hero. Amir Khan is a guide, is a coach. Any movie who is successful, take an example of Titanic. Take an example of Titanic or any movie. That movie would be successful, which shows a clear path how to make an hero to zero. Very, very important. This is the point which you have to understand. Now, your program director has 10 years of experience, 20 years of experience on dealing with good resident, bad residents, the residents who have a conflict. How can you tell the program director, hey, I'm not that kind of a person which you hired last year. I'm a person of ethic. That is a very critical point in your movie, in your story. Because Subab joined a little late. So what, Subab, we were discussing about pain points for the program director. Okay. So we have all the students have mentioned these are the pain points. Number one, they want the resident to be easygoing or easy to work with, team player, growth mindset, adapt, leadership qualities, easy with teams, knows the system, and is able to pass the ABIM boards. Okay. Dr. Sandhu is also joining. Dr. Sandhu. Okay. So this is what the resident is, the program director. We need to figure out the pain point of a program director. Now, the pain point of a university program director is what? He wants to publish, right? So you have to highlight your publishing skills. The pain point of a community program is that, hey, I want my kids to pass ABIM in the first attempt. That's why they give interviews to the high scoring. Some program directors are looking for that I am only going to give interviews to the person who has ethics, who has shown me. Now, what I have seen is that everybody will say, I am adapt, I am leader, I am this, I am that, I am made of resilience, I will do this. Nobody freaking tells the story. I what you have mentioned over here in all these points over here, what you have mentioned over here is, I mean, whatever you have mentioned, all the pain points you have mentioned, you are not telling the story. You have tell me about yourself, blah 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 blah. It's crammed and it is so fast. So, if a program director is interviewing me, now I can tell your micro gestures if I tell you my story, right? Somebody asked me, Dr. Singh, tell me about yourself. I will tell you about myself. I'm Dr. Singh. I graduated from Manipal in 2001, and I came to US in 2003, did my research job for 1.5 years. My journey has not been easy. My journey was studded with a lot of pit stops. First pit stop was that I used to stutter. I couldn't even speak my name, Harpreet. People used to bully me, and for since my birth to 1992 until I graduated my high school, I couldn't even speak my name. I couldn't even talk in front of the class. Because I was not able to talk in front of the class, I used to go to the whiteboard or blackboard at that time and draw pictures to explain my concepts. Because I used to draw pictures and make mnemonics, my brain is tuned in such a way, my neurons are connected in such a way that I overcame my stuttering with the help of doodles and mnemonics. Because of that, I'm able to make mnemonics and doodles like this. And this is the reason I've written 2 books. One is Vital Checklist, other is Road to USMLE Step 2. My another book is coming out, which is Stroke Alert. And I made it very simple with the help of pictures for the nurses to understand in this book. You see that? The story. So I have told the program director, I am resilient, I'm hardworking, I have written books, I have now I have laid my hook. Now the program director will remember that this guy is made up of a substance, right? Now, obviously, I love Subhav. I'm going to pick Subhav a lot in this. I love everybody, you know. So Subhav, I know his work ethics a lot. You know, this guy has a substance in it, not fluff. In his training session, I'm going to harp on work ethics, and work ethics. And when I start training him, he has organized a lot of meetings for a lot of doctors. So his CV will be all leadership. His CV will be of a chief resident. His CV will be, look, good score. You know, I know Rita. You know, obviously, I'm not going to say in this public platform over here, but she is a woman who has faced tons of adversity and has blossomed. And in her session, I'm going to do that. I know Kant. His English was absolutely nothing, and he has come up. So, all these are the adversities you have to tell me in your story. Yes, you can use the words growth mindset. You can use tell me, write the story for each thing. How are you easy to work with? How are you a team player? How you have a growth mindset? Stories. Tell me the stories. I know Arushi. Her story should move and make everybody cry what she has gone through her life. And if the program director does not cry on hearing her story, he he has to be moved with the story. Tare Zameen Par. Have you seen that movie, Tare Zameen Par? Beautiful story. What what do you remember in that book when he says the child goes apart? That is that is a story. Prashant. And if you now, Prashant, I want you to uh, um, in 1 minute, in 1 minute, I want you to explain encephalopathy away. 1 minute. Here,
Sure.
60 seconds. Your time starts now.
So I wrote a book chapter about the encephalopathy. So there are the two type of the encephalopathies. The first encephalopathy is the reversible and the second is the irreversible. So first thing that you have to do when you are checking any patient with the encephalopathy, you have to consider whether it's a treatable cause or whether it's a not treatable cause. So any kind of the encephalopathy with the liver disease lead to a hepatic encephalopathy in patient with the alcoholic liver disease, patient with the drug-induced liver injury. Second encephalopathy, I will discuss about the renal encephalopathy due to the chronic kidney disease, might be because of the diabetes, might be because of the SLE. The third thing that I would like to discuss about chronic hypoxemic encephalopathy because of the respiratory failure, patient with the COPD, patient with the lung disease. And irreversible encephalopathy, I would like to discuss about the epileptic encephalopathy, chronic metabolic encephalopathy, toxic encephalopathy. These are the encephalopathies that even if we are trying to do something, we cannot achieve the things that we want to do in the patient. But what we can do, we can decrease the time that patient can develop a full symptoms. We can decrease the time that it leads to a devastating symptom. So these are the things that I learned from the while writing the chapter.
So you see, his Prashant, I would want you to lower your camera because I was not able to see your hands. When you communicate with your hands, you are now Prashant was not able to even Prashant, be honest, from your growth curve. Were you able to speak so fluently when you started with me? Like your friend, you, and he was like this. Now the more up and down, and using hand like this, like this, like this. Use your hands properly. You know, it's beautiful. You know, and this is how you have to kind of change your mindset. You're already a star. Scores are good. You know, okay, now we have to just get to the next step. You need only one seat. That's it. You don't have to, first don't focus on where you get, focus on the next interview has to be amazing. Okay. So that this, we have looked at the pain points. That's the first thing. Have you guys watched Shark Tank? You, there is a Pakistan Shark Tank reader, and there is an Indian Shark Tank. There is a American Shark Tank.
I've not seen it.
Okay, make sure you watch one episode of Shark
Oh.
Tank.
Mhm.
It's very, very important.
Okay.
And the reason why you want to watch Shark Tank is because this will tell you the pathway. My daughter Sohani has has dissected each and every episode and all the pitches in 6 elements. That's it. She's doing business major, accounting major. So she's found that whenever Shark Tank gets best, the best evaluation, the person is able to pitch their pain points first. Then the second thing is instigate the pain point, means rubbing salt on the wounds. Third is cause and effect. Fourth is a knowledge gap. Program directors have a knowledge gap about you. Do you think when you are sending beautifully crafted letter is, I'm going to spend days in reading your personal statement. No, I spend 2 to 3 hours prior to the interview date looking at all the applications which I have to interview. I'm not spending days. I need to create a hook. I need to create a knowledge. There is a knowledge gap. The program directors have a knowledge gap. Then likability or links, networking. And then last is exit with gratitude. She calls it a pickle theory. P, pain. I, instigate. C, cause and effect or cost analysis of the product. K, knowledge gap. L, links. E, exit. What exit the the Shark Tank is going to get from the product. Now, if you dissect each and every element, what the program director is looking is, program director is looking, okay, is this guy solving my pain point? Will he be a team player, which I have explained you? That's the number one thing. Can a conflict, will he prevent a conflict? Okay, or will he be an instrumental in conflicts? I don't want conflicts. Then cost benefit of hiring this person. Now, cost benefit is very important thing. There's a book called as Innovator's Dilemma. Okay. In that book, the dilemma always comes is, I'm going to give you an example. This is very important. Now, your benefit is you're going to get salary of $64,000. New York will be high. Here and there will be less. Approximately $60,000 to $70,000. Your benefit is there. You're getting salary. You're getting trained. But you are not the hero. You are the coach to the program director. Hire me. I will make your life easier by publishing, by not being a pain in the ass. Do you understand? You cannot be pain in the ass of a program director by creating conflicts, right? You have to understand so how I explain this cost benefit analysis is with 2 phones. You have a Samsung phone, you have an iPhone. Your ecosystem is all iPhone. You have Apple Cloud, this, that, everything. You have an iPad, you have iPhone. And will you go to a Samsung phone, you have an Apple Watch? It will be very difficult. The first thing in cost benefit analysis is we are looking at the functionality. 2 phones are priced same, Samsung and iPhone. In fact, Samsung phone is a little better than iPhone, but still people are sticking with Apple because the hospital apps work a little better. That's why I don't want to change. First thing I'm looking at is a functionality. Second thing I'm looking at is a reliability. Third thing I'm looking at is a convenience. Fourth thing I'm looking at is a pricing. FRCP, England's degree, FRCP. Functionality, reliability, convenience, and pricing. Okay. Program directors are looking at a functionality. Okay, will he publish? Can he pass ABIM boards? Will he be or she will be a pain in my ass? Functionality, reliability, convenience. Okay, I don't have to apply for visa issues. Rita, that's why you got so many interviews. Convenience. Pricing, everybody, who cares about pricing? Everybody gets the same. So cost benefit, knowledge gap. How can you, in first 3 minutes of your interview, first 3 minutes, Tell me about yourself. Not blah 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 blah. No. How can you convince in first 3 minutes the program director that I am the chosen one? When you hire me, you will be done. Now, now what I have done is I know the people have remembered this. Tell me about yourself. I You have to know this question because the uh, person who is who does not know how to interview will ask you this question. Tell me about yourself. So then you will score good points over there, right? So you have to prepare this question. I'm not saying not, but with me, I will never ask this question. I will never ask this question. I will always ask a very difficult question because I want to see, and every time the question is different. Every time the question is different. I will never ask, tell me about yourself, because I know you have crammed it. I want to see your innovative. But as my students, you have to be smart. How will you take the steering, which which I have tricked you, and bring to your advantage? Even if I'm not asking, tell me about yourself, you and somehow you have to fit the story. You have to bring that out, that this is what I'm going to focus on. Mhm. If I ask, I'm going to very random question, which is not even linked to anything. Last year, one of my students got a question. I was amazed. And she's like, I told her that, that program director does not want to even hire you. Seriously. You know what question she got? How do you make a roti? How do you make a chapati? That was a question. Why? Why was why was that question asked? Can you tell me?
Maybe she had mentioned somewhere in her application that she's into cooking.
And she did, like, again, there was a mistake which happened. Never again, if you have answered that question, cooking is hard. Chapati banana is not easy. It's difficult. It's difficult. But if I was a smart person, what would I have answered? Rita, what will you answer? If I if if you had to dodge this bullet, let's say you wrote cooking. If you had to dodge this bullet,
Maybe I would just start explaining the process. I mean, I don't know. I think if
how
it was me and this question was randomly thrown at me, I would just start explaining the process. Like, you have to take a flour and then you just mix it water, you try to mix that thing up and something along those lines. I think
yeah, no, just explain. The reason I'm going to show you the trick, how to overcome a tricky question, but explain the process.
Okay, so what you do is you take some raw flour and mix it with certain amount of water. You have to take care of like how the amounts of water and the flour you have to mix it. and then you get the dough, keep it in the fridge for a couple of minutes or like half an hour. Then you just when you have to make it, you take a certain amount of that flour, you roll it up, try to make it flat, keep it in the form of a circle, and then put it on the stove, like cook it on the pan, flip it on both sides, and yeah, that's it.
So here you use your hands beautifully.
Mhm.
Remember, using hands make you a better orator. That's one thing which I noticed. So in this step by step, that means you have really done cooking, because I never knew that you have to keep in a fridge, to be very honest. But if I lied in my application, I would, if I would have to answer this question, I love cooking. By that I mean I love making vegetables. For making chapatis and rotis, I use roti maker. All right. So again, if you are thrown a curveball, you have to be very smart that how you are going to overcome that curveball. So now remember, in your story, when they ask you about a challenging question, they are always asking your hardships, adversities, you know, they are always asking. I know everybody's adversity over here because I've seen your applications, I've done in, so I don't want you to give your golden nuggets over here, because then, you know, don't even say that. So the point which I want to make, understand is your hook story has to be very crisp. When we are doing your sessions, your time, starting at 8, make sure your stories are lined up. Everything has to be okay. What is the pain point? Okay, work ethic story, your team player story, your leadership story, your passing the board story, uh, easy to work with the story. Whenever they ask you any question, tell me the story. Story sells, story sticks. All the words which you are saying, they are the words. But remember, those, remember, I'm a mnemonic maker. I also make mnemonics. But if you can club those mnemonics with your stories, that is your rock star. Please go ahead and ask me questions before we wind up this session and we go to 1 hour each. We'll go 1 hour each with everybody. Please go ahead and ask me the stories or questions.
Can I start, sir?
Yes, absolutely, Subhav, my friend.
Yes. So first of all, thank you for guiding us. And for the session, I joined in late, so I did not get the
Oh,
opportunity to say that.
no worries. I know you
And
must be helping somebody.
I was helping myself.
Yeah, no, it's okay. That is also important.
So, one of the questions I want to ask is, what if, I know the likelihood might be low of this, but what if I'm asked a medical question or a clinical question, a clinical scenario, and I am not able to navigate how to answer that? Maybe I have a knowledge gap, maybe I don't know, or maybe I cannot remember that time.
Yeah, I always
How,
ask the clinical questions.
okay, so how to like I have a framework in mind that, whenever I don't know anything, I would first, go by the basics, stabilize, history, physical exam, and anything. And if I'm not able to answer what they are trying to listen or what they want to hear, how to navigate that situation.
Do you know anatomy?
Yeah, I think so. Yes, little
Do you know
bit.
physiology?
Yes.
take. So, Dr. Singh, I am going to take the help of anatomy and physiology to explain this concept. They're not going to ask, the reason why they're asking you or I ask clinical questions is I want to understand your communication skills. I'm not asking this for a sake of being 100% right.
Mm.
I want to see your mind. I want to see where you are working, how, what is your thought process behind. If when you rotate with me, when you come, you will see how I operate. I always keep my patients in the center, patients first. I'm going to explain to the patients with the help of anatomy and physiology. If you have a chest pain, I will go from inside out. If you have asked, give me the differential diagnosis of chest pain, people will say, um, 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 no, don't say So remember you put the filler words. Dr. Singh, I'm going to, this is a very nice question. Thank you so much for asking me this question. I'm going to explain this answer with the help of anatomy and physiology. So the differential diagnosis of chest pain starting from inside to outside is in right in the center, I would say, is esophagus, esophagitis, odynophagia. So in the odynophagia, ibuprofen, doxycycline, potassium pills, gastritis, then mediastinitis, aortic dissection, then I will say chest, heart. In heart, vessel, valve, wall, wire, covering of the heart, then lungs, lungs, tubes and balloons, acute bronchitis, balloons, pus, water and blood, then covering of the lungs, then rib cage, costochondritis, fracture of the ribs, then skin, shingles. After explaining all the anatomy and physiology in my mind, I always look for which can become urgent. Oh, what PE, pneumothorax, heart attack, aortic dissection. So I'm going to order the test troponins, EKG, chest X-ray, or CT scan, CTA. This is my thought process. If the patient comes with abdominal pain, there was a girl which I interviewed last year. Crisp, crisp thought process, very crisp. Absolutely fantastic thought process. Now people will start confusing with what? If I asked you abdominal pain question, how will you explain the abdominal pain? Can't. How will you dissect abdominal pain? Or Subhav or Rita? Do you want to? Who wants to take a try on abdominal pain? Who wants to try abdominal pain? And I can explain you what mistakes, and I can help you to change the whole narrative. Who wants to try?
I
I
can
can
go
try.
for it.
Okay.
Okay, go ahead, Kanika.
So first we will ask from the history, we'll ask if the pain is constant or intermittent. So based on that, we can figure out the organs which can be involved, if it is a solid organ or a hollow organ. And then the type of pain and the character of pain can help us understand the organ as well. And then the location. Is it in the front of the abdomen or is it coming from the back? So is it actually an abdominal pain or like a renal pain?
Very good. Mm-hmm.
So that this way, like, and the if it is in the front, then which quadrant? Is it the right upper quadrant, epigastric pain, or the right lower quadrant? Is it a female or a male patient? So based on that, we will analyze the organs as well.
Very good.
Yeah,
Mm-hmm.
that's pretty much it.
Okay. So let me explain you in my way. So and so when a patient, Subhav, you want to try? You were about to try.
Sure, I can. So if I was presented this case that a patient comes in with acute abdomen and let's say it's in the ED, first I would, again, like I like to go back by the basics. I would first see how stable the patient is. So that means vitals. First stabilize the patient. And then acute abdomen can present, in a different ways in different people. Sometimes MI can also present as acute abdomen. So first I'm looking to rule out the most urgent cases. So after assessing the vitals, I would check the oxygen saturation, get an EKG, and while doing that, I would also focus on history and physical exam. Hopefully from that I'm able to get some information that when did the pain start, where is it located, what increases or decreases the pain, does it radiate somewhere, and maybe during physical examination I'm able to find out certain factors which help me locate in my head what am I looking at or deduce my differential diagnosis. So for example, if the pain is constant is nature, it's in the epigastric region, it's radiating to the back, then maybe I'm looking at, and it's very acute. Maybe in my head, I'm thinking to rule out acute pancreatitis. If it's in the right upper quadrant, maybe I'm thinking some, liver, gallbladder pathologies. And if the patient is old and it's left lower quadrant, so depending on various factors given to me, it'll be a dynamic process and I'll rule out certain conditions from urgent to less urgent and carry out tests, uh, imaging in blood accordingly, and hopefully come at a conclusion.
Mm. Very good. Very good. So if your answer is pristine, perfect, but if I add 4 points more to it, 4 points, this will become even better. That will become your hook. So everything's right, urgent to non-urgent. You go examine the patient. Patient has guarding or rigidity, right? If the patient is guarding or rigidity, you will stop everything and call the surgeon,
Yeah,
right?
peritonitis.
Right? That's one point. Second point. So you have done everything. I'm just asking questions. When you are on the phone with an ER doctor, what 4 questions you are going to ask? Where is the location of the pain? Or the pain is in the right upper quadrant, right?
Mm.
Okay. Is the pain a cramp-like pain or a non-cramp pain? A cramp-like pain is a pain which is in the tubes. It's a hollow organ pain. Prashant knows, Kanika knows, they're rounded with me. It goes in the tubes, right? That means that if the right upper quadrant pain is in the bile duct, gallbladder, because they are tubes, right? If the pain is a non-cramp in the right upper quadrant, which are the solid organs, the pain
Liver.
in the liver, which is the solid organ on the right upper quadrant, spleen and pancreas, which is
You mean
the, sorry,
you mean left upper quadrant?
oh yeah, sorry, left upper quadrant, spleen and pancreas. Then if you have a pain in the first, second, third, and fourth part of the duodenum. Second, third, fourth part are retroperitoneal, but it is a tube, right? Pain, which is a cramp, like, but it's in the back, right in the middle over here. Second, third, fourth. So you have to define the question. Is the pain location cramp-like, non-cramp-like? In the front or in the back? In the back, retroperitoneal, sad puckers. Out of this, everything is you have done everything right. First, sandwich these questions in between. Perfect. Anatomy, proper consults. So you are in the right path, but again, you have done right. Clarity of thought. How would you treat a patient with, last year this was my favorite question, with hyperkalemia. This year I'm not asking this question because everybody knows my question. So again, it's a art. If you have scored 260, you should be able to answer hyperkalemia. If you have scored 250, you should be able to answer hyperkalemia. I don't have to coach you. If you have passed your USMLEs in such a good, you should be able to answer some. And I am not looking at the correct pathway completely. No, I'm looking at the how you're talking, whether you are concerned or not. Any other questions? Harkanwar is very quiet. I don't know why. Dr. Sandhu? That's fine. Okay. Go ahead, guys. Rita, Arushi, any questions?
Not right now. Maybe when there's
Yeah.
one-to-one session, I'll
Fine.
just
Yeah.
shoot us.
Dr. Singh, I do have one question.
Uh-huh. Oh,
So, how to deal with the question which test your ethical situation and the scenario? Is there any framework that we have to use to deal with this kind of questions?
so this is a very good question, in fact. Remember, in life, whether it's an ethical, whether it is a conflict, whether it is angry patient, whether everything in the books, they have mentioned the spikes approach in the books, but I'm not really big fan of that spikes approach. There's a reason behind it. It is just a mnemonic. I have developed an approach which you will like a lot. I'm going to explain you. Before I explain you, who is from 8 to 9? Prashant, are you from 8 to 9?
Yes,
Okay.
I am.
Okay, so then it's your question. I will answer it right over here. It will be perfect. Okay. So now this is a question I'm going to tell you with a story. Okay, very important, very important. Please note each and everything. I call this as the please technique. The please technique. Okay. Now, Prashant has asked me a question, ethical question. Prashant, that is a phenomenal question about ethical approach to an angry patient, ethical approach to a conflict management, ethical approach to discussing with patients' families. So whenever a question is asked, you guys ask me any question, give me a tough scenario. Give me a tough scenario. You give me a tough scenario and I will explain you with the help of whatever scenario you will give me, I will paraphrase that. P, paraphrase, is called as reciprocal learning. Now, paraphrasing. So now, let's say take an example of Subhav. Okay, I'm going to pick on Subhav because he's my favorite. So, so Subhav asked me a question about if I'm asked a clinical question, what did I do? That's a very good question about clinical questions, and I do ask clinical questions. What did I say to Subhav? Paraphrase. He knows that I heard his question.
Mm-hmm.
So he knew I heard. If Aroma, my wife, asked me something like yesterday, I had no contact with the computers. I said, I want to completely get away from the computers. I want to go and spend time with Aroma. What I did was we went to Chicago for a break and we walked and walked and walked and walked. She, a day before, she said to me, honey, you don't spend time with me. And I had interview sessions yesterday. So what I did was I canceled everything. And she's right. 7 days I was working and then I had administrator things. So what I did was I took an action that I don't want to be part of interviews today. I want to spend time with Aroma. So we went at 10 o'clock, we went on a train. I've never gone on a train to Chicago from Valparaiso to Millennium, Michigan Mile. We walked, we had lunch, we had dinner, we shopped and we walked and walked. That's my I heard her. Not only I heard her, I took an action. Paraphrase. Paraphrasing is not only hearing, but taking an action. I gave Kant an idea that if you want to improve your English, take an action. Spend $170 on this bold voice app. Take an action. He took an action. Paraphrase is okay, Dr. Singh, I will take this accent training course and I will do bold voice and I will improve. And once you see him, so paraphrasing is that question is very interesting, Dr. Singh, about abdominal pain, about chest pain, about this. And I'm going to go with the help of anatomy and physiology. This will give you a buying time. Then L, listen, deep listening. And people will say, listening, 18 seconds is a time when physicians will cut off their patients. 18 seconds. Patient is speaking. Within 18 seconds, physicians will say, okay, I'm done. Listen and label their emotions. If I give you the opportunity, you say, I'm going to explain you in detail about chest pain from starting from inside to outside approach or outside to inside approach. I would say inside to outside because major things are happening inside. Listen and label their emotions. So what did I do with Aroma yesterday? I labeled her emotions. Oh, you don't spend time with me. Okay. I not only took an action about this, I went and labeled labeled her fears. Not spending time, I spent entire day with her. Labeling. E. What is E? expectations or desires. And this is all based in neuroscience. My other student, Barun Agrawala, has done a research on this. I've given the article. He's written an article. We're going to send it to the Patient Experience Journal. Expectation, desire. What is your expectation? आप चाहते क्या हो? What is your expectation? Angry patient. What is the expectation? I want the lauded. Yes, I will give you the lauded, but I have to get to the bottom of it. I have to do some tests. Then PLEA, ability, making them able. There's a book called as Tiny Habits. They say don't motivate the patients, make them able. Ability, making them able is more gratifying for the patients because you have given them a tool. Motivation is fluff, is in the air. You've given them a tool, ability. Like Prashant, you have rounded with me, right? Remember we explained that label 2020. So I'm making them able. Okay. I'm not saying, okay, change your diet. What I'm saying is follow that 20% rule. Kanika has rounded with me. Remember Kanika?
Yes, Dr. Singh.
Yeah. So
It was okay.
I've given them the ability, not change your habits. Then S is called as salience. Salience is reward, is novelty, giving them a brand new reward. If I tell the patient that, hey, smoking cigarette causes cancer, it's written everywhere. Nothing is new. But if I tell a woman that it causes wrinkles, smoking cigarettes causes wrinkles, that's fine. Who cares? But if I tell a person who has a back pain that, hey, if you have wrinkles on the face, the collagen and elastin is gone over here. Your collagen and elastin in the back is also gone. That's why you have a back pain. Now the person will say, really? If they don't know anything new. And the E is again end with gratitude. So your question of whether it is a conflict management, whether it's an angry, whether it's a dilemma, whether it is anything, use the please technique. Okay, paraphrase. That is a very good question. And I would like to explain you with the help of a story how to deal with an angry patient. Let's a patient comes asking for the lauded for the back pain. I would tell the patient first I have to take the history. I have to do a physical examination. I have to make sure that I have the radiology test with me. But what I will do in meanwhile, because you are hurting so much, I will give you a very small dose of medication so that you can undergo through these tests. Listen, label, expectations you met, ability, but I would want to get to the bottom of this cause. And I always love root cause analysis. What is happening in here? Root cause the problem. Right? And I understand you are hurting. Sometimes patient will ask, Dr. Singh, can you give me the medications, Norco, to go home? As per the Indiana law, I can only give 3 to 5 days worth of medications. You have to go to your doctor about that. But I will give you some medication. But you came here as an narcotic overdose. You know, I will give you medications which are non-narcotic, and I want, but I will make sure I'm going to call your doctor right in front of the patient. I'm going to call the doctor and make an appointment. So patient knows that I'm calling right then and there. So anything comes, you are able to help them with, don't remember so many models. The model which I have developed is a part of the spikes, is part of this, part of that. I've like read so many books on this and then made my own model. I mean, I can share the research. I think Barun has the research article. He's not, he was supposed to join. But anyways, any other questions before we take like a 2-3 minutes break before I start with Prashant? Any other questions, guys?
Just a small logistical question. I had written on the group anytime is fine with me, so I just wanted to know which time am I meeting you.
Whichever time you're now left with,
Which
wherever you fit in, just see.
I'm free, like, so will you let me know or like
No,
how
like
is it?
go to the group and whatever time the kids have not picked,
Okay, okay,
that will be your time.
okay, perfect.
That's why I get because I don't want to be partial because I love you all guys.
Perfect.
So Puff, it's the same for me. So if you can choose a time, then I can choose the time after that. That would be
What
fine.
whatever I it doesn't matter. I'm here for you entire day. Um,
Thank you
10
so
hours
much,
are
sir.
for you guys. So I'm sitting here in my room in my study, and I made my wife happy yesterday. So that Rita is laughing.
Yeah, I can understand.
I- okay.
Take 1 to 2, then I think no one's has taken 1 to 2.
Okay. So anything? So let's